This video will focus on post-traumatic stress disorder, or PTSD, and the different modalities used in its assessment and treatment. PTSD is an anxiety disorder that can occur after experiencing or witnessing a dangerous event. According to the National Institutes of Health, approximately 7.7 million American adults are impacted by PTSD. When a person is in danger, it is natural for the body to feel fear. This fear initiates the body's natural response to defend against or avoid the danger. This is known as the fight or flight response. The body undergoes rapid changes, such as increased heart rate, dilated pupils, and quick, deep breathing to prepare for immediate action.
The fight or flight response is meant to protect a person from harm. However, in PTSD, this reaction is damaged. Individuals with PTSD may feel stressed or frightened, even when there is no longer a threat.
Anyone can develop PTSD at any age. It affects war veterans, survivors of physical and sexual assault or abuse, accidents, disasters, and other serious events.
It's important to note that not everyone with PTSD has directly experienced a dangerous event. PTSD can also occur after a friend or family member is harmed, or following a sudden, unexpected death of a loved one. PTSD causes many symptoms that are grouped into three categories: re-experiencing symptoms, avoidance symptoms, and hyperarousal symptoms. Re-experiencing symptoms include flashbacks, bad dreams, and frightening thoughts. These symptoms can be triggered by thoughts, feelings, words, objects, or situations that are reminders of the traumatic event. Avoidance symptoms involve staying away from reminders of the experience, feeling emotionally numb, having feelings of guilt or depression, losing interest in enjoyable activities, and difficulty remembering the event. Avoidance symptoms can cause a person to change their personal routine. For example, after a car accident, a person may avoid driving or riding in a car.
Hyperarousal symptoms include being easily startled, feeling on edge, having difficulty sleeping, and experiencing angry outbursts. These symptoms are usually constant and can make daily tasks difficult. Initial symptoms that disappear after a few weeks are referred to as acute stress disorder, or ASD. If symptoms last longer than a few weeks and become an ongoing problem, they may be PTSD. Some people with PTSD may not show symptoms for weeks or months.
PTSD symptoms in children and teens can differ from adults. Symptoms in young children can include bedwetting, forgetting how to talk, acting out the event during playtime, or being unusually clingy. To be diagnosed with PTSD, a person must have symptoms for at least 1 month. This includes at least 1 re-experiencing symptom, 3 avoidance symptoms, and 2 hyperarousal symptoms, all of which interfere with daily life.
PTSD can be treated with psychotherapy. Psychotherapy is talk therapy, involving discussion with a mental health professional. Treatment for PTSD usually lasts 6 to 12 weeks, and support from family and friends can be helpful. The FDA has approved 2 antidepressant medications for treating adults with PTSD: sertraline, or Zoloft, and paroxetine, or Paxil. Both are also used to treat depression.
The FDA issued a black box warning for these medications. This is the most serious warning on prescription drug labeling, alerting clinicians to serious risks. The warning stresses close monitoring for patients of all ages, especially initially. Families and caregivers should report changes, as side effects can include worsening depression or suicidal thoughts.
Doctors may prescribe other medications, though there is less information on their effectiveness for PTSD. These include benzodiazepines to help with relaxation and sleep, and antipsychotics for other mental disorders. Research shows that inappropriate brainwave activity is central to most neurological disorders. Neurofeedback trains the brain to normalize brainwaves, making them flexible and adaptable with permanent results. Neurofeedback is based on the idea that the brain has a normal pattern of electrical activity, and it regulates itself using this pattern.
When this normal pattern is disrupted, it leads to a dysregulated brain, resulting in neurological symptoms. Dysregulated brainwave patterns are identified using a quantitative electroencephalogram, or QEEG.
A healthy, regulated brain can smoothly shift between slower, resting states and faster, focused states as needed. This flexibility supports emotional regulation, concentration, learning, relaxation, and overall cognitive performance. Global dysregulation occurs when the brain has difficulty maintaining balance and flexibility across multiple systems, making it harder to regulate attention, emotions, stress responses, sleep, and overall functioning. There are 3 types of global dysregulation: delta or theta dysregulation, alpha dysregulation, and beta dysregulation. Delta-theta dysregulation is a pattern of brain activity associated with an under-aroused brain, where information is processed more slowly than normal. This slower processing speed may contribute to challenges such as attention difficulties, impulsivity, distractibility, emotional regulation issues, learning problems, and other cognitive or behavioral concerns. Alpha dysregulation is associated with an inhibited brain, where processing occurs at an idle or reduced level. This pattern may contribute to symptoms such as depression, rumination, irritability, avoidance behaviors, low self-esteem, emotional withdrawal, and difficulty engaging fully with daily activities and relationships. Theta dysregulation is associated with an over-aroused brain, where information is processed at an excessively fast rate. This heightened state may contribute to symptoms such as anxiety, excessive worry, panic attacks, hypervigilance, insomnia, obsessive thinking, restlessness, and difficulty relaxing or adapting to change. This brain map suggests a mixed pattern of dysregulation, with the strongest findings in overarousal, while cognitive, underarousal, and inhibited measures appear to be in the mild to moderate range. The symptom correlations indicate potential challenges with attention, reading and verbal processing, impulsivity, emotional regulation, anxiety, excessive worry, hypervigilance, and obsessive thinking. Overall, the results suggest that the brain may be working harder than necessary to process information, contributing to difficulties with focus, stress management, emotional balance, and cognitive efficiency. These findings can help guide neurofeedback training and other interventions aimed at improving self-regulation and optimizing brain performance.
The BrainCore Brain Map provides the information needed to perform neurofeedback training. The Brain Map's purpose is twofold: to identify global and focal dysregulatory brainwave patterns, and to provide the best neurofeedback protocols to correct these patterns. The goal of neurofeedback is not to diagnose or treat a condition, but to transform unhealthy, dysregulated brainwave patterns into a normal, healthy, organized pattern. In the neurofeedback process, individuals are connected to a computer via wires and sensors to read their brainwaves. Information about these brainwaves is then displayed on the clinician's monitor. The software automatically detects when the brainwaves are properly ordered and feeds that information back to the patient. This feedback is presented as a game, movie, or sound, signaling to the patient that their brainwaves are becoming more organized. By having information on what your brainwaves are doing, your brain can use that feedback to change how it works. Neurofeedback is based on over 40 years of clinical research proving its efficacy, supported by various professional organizations. Dr. Frank H. Duffy, a professor at Harvard Medical School, stated that if medication showed such efficacy, it would be universally accepted and widely used.
In 1991, Peniston published a study using neurofeedback with Vietnam veterans suffering from PTSD, comparing a traditional therapy group to a neurofeedback group.
Only the group that received neurofeedback, in addition to traditional therapy, tested within normal limits by the study's end. Most maintained a normal life 30 months later.
For more information, please visit www.braincoretherapy.com for articles on medical research demonstrating the effectiveness of this therapy for various conditions.